Good evening. Welcome. Here is today's news wrap and update from the White House and beyond. Today we begin by zooming in on the consequential talks that is taking place today in Beijing, China between the U.S. and Chinese officials. White House National Security Advisor Jake Sullivan and China Foreign Minister Wang Yi are meeting today and the next 2 days to discuss thorny issues that affect their complex frenemy relationship and that will have consequences impact on the global economic as well as the global trade. These issues include relating to Taiwan, relating to as well as China's military support for Russia, and the regional issue relating to in South China region, as some of the issues, as well as artificial intelligence, as some of the issues that are being discussed during the next couple of days, that these two major powerful economic, the number one and the number two economic in the world, are taking place in Beijing, China today. Our National Security Advisor, Jake Sullivan, after today's meeting, told reporters that President Biden has been very clear from the beginning in his conversation with President Xi that he is committed to managing the important relationship between the U.S. and China responsibly, working to ensure competition doesn't veer into conflict and finds ways to work together on mutual global issues. The foreign ministers, Wang Yi, responded that in his remarks said the U.S. and China relations is of critical importance for both countries and the rest of the world, and also said they will focus on mutual respect, peaceful coexistence, and a win-win situation. Issues that they also will be talking about will include tackling the climate crisis and financing for developing country and debt relief for developing country, emerging country, such as African nations. And staying within this talk build upon, as we've reported earlier this week, this talk build upon other meetings that have taken place in the past 3.5 years since the Biden presidency, that are to manage the relationship, as National Security Advisor said in his remark, that the president as well as the U.S. and China are both global rivalry, but trying to find a way to manage their relationship because they know that there will be consequences for the global world, for the global economy. Of course, these visits also build on other visits from cabinet members, including the Treasury Secretary Janet Yellen that traveled to China earlier this year, as well as Secretary Antony Blinken was also in the country, just again to talk with officials one-on-one to ensure that the competition between the two powerful economics doesn't veer into conflict, and find a mutual way to work together on global issues such as providing climate financing, addressing the high debt distress in developing countries, and tackling the climate crisis. We will be bringing you more updates in the next few days regarding this talk as we get it. Also, in the meeting, the White House announced following Jake Sullivan meeting that the President Biden and President Xi Jinping, in the next couple of days, in the next couple of weeks, we have a phone call. We talk on the phone as the two leaders have done previously before they met in last November for their summit in California. The next and staying in China, in that region, the Chinese government will be hosting the annual Forum on China and Africa Cooperation that is held every 3 years and is the first since the world emerged from COVID-19 pandemic. So at least 53 African, um, 53 leaders from African countries are expected to travel to China to participate in the forum, including President of Nigeria, President Tinubu, who announced that he will have a one-on-one with the Chinese president on issue relating to Nigeria, on investment, on financing relating to cooperation between China and Nigeria. Also, that it was announced that will participate, attend that event also is the South Africa Minister of Trade. We also is one of the leaders that will be participating, attending the forum in Beijing that is taking place from September 4th next week through September 6th. And moving to other story that we are paying closer attention to regarding the Mpox virus, the Mpox outbreak in Africa and in as well as in other countries. The World Health Organization said more than 22,000 cases and 622 deaths have been reported so far since since the outbreak began, and there's been an increase of 200% in the past couple of and especially this they are seeing more cases among young children, younger children. The previous cases have been between adults and in adults, but right the ongoing outbreak, majority of cases are affected are found in younger children of between age 9 and 5 years old and younger, that are significantly affected by the Mpox virus. The Director General Pedro said that the agency is working with global partners and has received information needed from vaccine makers to evaluate their product emergency use listing. And in the next 3 weeks, that they will release those lists to the public, and they have given Gavi and UNICEF the green light to proceed with procurement of vaccine. As we have reported, there have been commitments from global partner from the U.S., from Germany. Yesterday, Spain announced that it will donate 500,000 Mpox vaccine to the region to help with the response to halt the spread of the outbreak. The U.S. also, it was announced yesterday that the U.S. government donated 10,000 doses of Mpox vaccine to the Nigerian government to help with the outbreak in that country. Again, we continue. This is an ongoing issue that the World Health Organization, a UN agency, is working with global partner, and it announced last week that it will need at least $158 million to address this ongoing outbreak, Mpox outbreak. But I believe the Director General also said in his remark that He believed this outbreak can be contained and can be addressed with the right resources, if the right resources are provided. Again, so far, more than 800,000 doses of Mpox vaccine have been donated, have been pledged between the U.S., France, Germany, EU, Spain, Japan, as well as other global partners that have committed to ensure that the response to the outbreak in currently in 12 African countries right now are contained and receive effective response. Another story in the region that we are focusing on, Undersecretary Jenkins arrived in Kenya today for a 2-day visit to engage with policymakers and industry leaders on the future of nuclear energy on the African continent. We are again focusing on that issue, on that story. And our next story is in South Africa. The South Africa, as I mentioned, South Africa Trade Minister, the new Trade Minister will be traveling to China, Beijing, China next week to engage with Chinese officials. South Africa, the Department of Agriculture, South Africa Department of Agriculture is in the process of finalizing requirements related to the control management system, which may include additional requirements of documentation to support labor claim of imported food products. The aim of the regulation is to require producers of both domestic and imported food to substantiate the control management system under which they claim their products were protected. Another news from from South Africa relating to trading with South Africa is they announced a new tariff on imported sugar due to the downward global sugar prices, and we apply to sugars imported to Southern African Custom Union and to except for Eswatini. The other story that we are paying closer attention to is on maternal health. The Biden-Harris administration announced that it will invest over $558 million for maternal health, to improve and address maternal health crises, including pregnant and new mom, infant, children through home visit program. The investments will be managed through an agency under the Department of Health, the Health Resource and Service Administration. We manage the funding, the investment, and work with local partners across the country to address one of the most critical issues that affects women.
It is an honor to welcome all of you to this first ever White House Day of Action on Maternal Health. And I want to thank everyone gathered today, the members of our cabinet, including Secretary Javier Becerra and CMS Administrator Chiquita Brooks-LaSure. And I want to thank the members of Congress, the state and local policymakers, the business leaders, the nonprofit leaders, the medical professionals, the community organizers, the patient advocates, all of you. Thank you for your leadership and your tireless work. And thank you for your partnership and your commitment to take bold action to improve maternal health. This challenge is urgent, and it is important. And it will take all of us. And to put it simply, here's how I feel about this. In the United States of America, In the 21st century, being pregnant and giving birth should not carry such great risk. But the truth is women in our nation, and this is a hard truth, women in our nation are dying. Before, during, and after childbirth, women in our nation are dying at a higher rate than any other developed nation in our world. And when we know that, for some women, the risk is much higher, when we know that, we should do something about it. When we know that today, Black women are 3 times as likely to die from pregnancy-related complications, we should do something about that. When we know that Native American women are more than twice as likely to die from pregnancy-related complications, we've got to do something about that. When women who live in rural America, which has many maternal care deserts, meaning there are no maternal care facilities, and when we know that women in rural America, for that and other reasons, are about 60% more likely to die from pregnancy-related complications, we need to do something about that. And think about it, regardless of income level, regardless of education level, Black women, Native women, women who live in rural areas are more likely to die or be left scared or scarred from an experience that should be safe and should be a joyful one. And we know a primary reason why this is true: systemic inequities. Those differences in how people are treated based on who they are. And they create significant disparities in our healthcare system. And when it comes to pregnancy and childbirth, these systemic inequities can be a matter of life and death. So let us all say, unequivocally, maternal mortality and morbidity is a serious crisis, and one that endangers both public health and economic growth, which means everyone is impacted by it. Because just think about it. Mothers are the backbone of our economy, and their children are the future of our economy. We know that when women do not get the health care they need, families suffer, communities suffer, and our nation suffers. In fact, one estimate suggests that the direct and indirect cost of poor maternal health care could total more than $30 billion. $30 billion in a single year. By the same measure, we know that when we invest in women's health, when we invest in maternal health, economic productivity increases and socioeconomic outcomes improve. It is clear, a healthy economy requires healthy mothers and healthy babies. I will repeat that. A healthy economy requires healthy mothers and healthy babies. And that is why today, on behalf of our administration, I am issuing a nationwide call to action to both the public and the private sector. Through this call to action, federal agencies, businesses, and nonprofits will join together and will work together to solve this crisis. So today, to kick off this effort, our Department of Health and Human Services and Centers for Medicare and Medicaid are launching a new initiative to designate birthing-friendly hospitals. So this is a brand new designation, and the first designation that rates a hospital based on the quality of its maternal health care. In addition, more than 20 companies and nonprofits have pledged to invest more than $20 million in maternal health efforts domestically and more than $150 million globally. They have pledged to invest in remote care monitors for...
And so this issue, although the vice president spearheaded this particular program, it was launched in 2022, that she has been working with local partner health officials around the country to address, as I said, one of the most critical issues that affects women, maternal health crisis, often where that also significantly affect Black women. So the administration, we earmark through the CDC, earmark a new $118.5 million over 5 years plan investment to build on public health infrastructure to better identify and prevent pregnancy-related death. They will also expand support to maternal mortality review committee. These investments, among many other things, we have significant consequences, positive consequences. As we know, maternal health issue is not just a U.S. related issue; it's a global issue. And through the U.S. Agency for International Development, many of these issues are addressed in developing countries, where we see as well a lot of issue affecting new mom, affecting pregnancy. So these investments that will be given to ensure that new parents and new moms, infants and children, continue to receive the care that they need, and so the care and the support that they need during the early years of during the early years of the infant and the baby. We also, as I said, research into research into, as well as prevention into maternal health deaths. All of these we have significant impacts on our programs that are working, local programs that the USAID and partner that the USAID work with on in Africa and across other developing countries. So this wrap up our news. Oh, finally, it was announced that we mentioned last week that President Biden, we joined the vice president on the campaign trail, and it was announced today that the president next week will be joining Vice President Kamala Harris for a campaign event in Pennsylvania. The vice president today is on the campaign trail, traveled to Georgia, and where she is campaigning with her running mate, governor of Minnesota, Tim Walz. And this wrap up our news for today, for August 28, 2024. Thank you very much for watching. I'm Kemi Oshukoya. See you next time. Have a good evening. Thank you.